Let's talk about mental health. Before we can start, we have to define mental health. Mental health and mental illness is very broad, with over 200 recordable and diagnosable mental illnesses to date, according to Mental Health America. MentalHealth.gov defines mental health as mental health includes our physical, psychological, and social well-being. It affects how we think, feel, and act, but it also determines how we handle stress, relate to others, and make choices. Mental health is very important at every stage of life, from childhood and adolescence to adulthood. They contribute 3 factors to mental health: biological factors, such as genes or brain chemistry, life experiences, such as trauma or abuse, and family histories of mental health problems. Mental health has continued to increase in America, especially among teens from ages 14 to 24, and while activists are speaking out and sharing their experiences with the problem, it's not being effectively addressed by the government. So, what measures should be taken by the U.S. government to help the mental health issue among teens? To answer this question, we have to see what the government is doing now. The government has begun to spread awareness around the issue of mental health, especially around teens. However, not in the best ways. The only time mental health awareness is advocated for is in the aftermath of a mass shooting, to turn the spotlight away from the guns the shooter was carrying. This has a lot of negative effects towards the spreading and education of mental health awareness. Politicians are labeling people who suffer from mental illness are violent or crazy when unmedicated or untreated. In reality, this is not always the case. A study published in 2015 by the American Journal of Public Health called Mental Illness, Mass Shootings, and the Politics of American Firearms showed that less than 3 to 5% of U.S. crimes involve people with mental illness, and the percentages of crimes that involve guns are lower than the national average for persons not diagnosed with mental illness. And that database that tracks gun homicides, such as the National Center for Health Statistics, similarly show that fewer than 5% of the 1,200 gun-related killings in the United States between 2001 and 2010 were perpetrated by people diagnosed with mental illnesses. The vast majority of people diagnosed with psychiatric disorders do not commit violent acts. Only about 4% of violence in the United States can be attributed to people diagnosed with mental illnesses. Many will say that mental illness, like schizophrenia, have a bigger risk of danger to the person or the people around them. That's only somewhat true. In extensive surveys of police incident reports, it is demonstrated that far from posing a threat to others, people diagnosed with schizophrenia have victimization rates of 65 to 130% higher than those of the general public. NAMI, or the National Alliance on Mental Health, has published a statistic on the past year showing that shocking results on how mental illness is impacting America, and most importantly, America's youth. In their statistics, they state that approximately 1 in 5 adults in the U.S., or 46.6 million, experience mental illness in a given year. Approximately 1 in 5 youth aged 13 to 18, or 21.4%, experience a severe mental disorder at some point in their life. For children aged 8 to 15, the estimate is 13%. 70% of youth in juvenile justice systems have at least one mental health condition, and at least 20 live with a serious mental illness. Only 41% of adults in the United States with a mental health condition received medical services in the past year. Just over half of children with mental conditions aged 8 to 15 receive health service in the previous year. Half of all chronic mental illnesses begin at age 14, 3/4 by 24. Despite the effective treatment, there are long delays, sometimes decades, between the first appearance of symptoms and when people get help. Looking at these stats, it's clear that very little is being done by the U.S. government to help this epidemic in the United States. If we are to substitute mental health with cancer, people would be outraged if 50% of people that had cancer didn't get treatment in the past year. Treatment should be widely available to people who are diagnosed with mental illnesses so they can get help. So what should be done about it? What is being done? Well, let's start with what's being done. A big question that is being discussed is whether to continue funding for certified community behavioral health clinics. These health clinics are in the community that are designed to finance clinics that pay for themselves. These health clinics were created through Section 223 of the Protecting Access to Medicare Act, or PAMA, which establishes a demonstration program based on the Excellence in Medical Health Act. Section 223 is a 2-year, 8-state initiative to expand Americans' access to mental health and addiction care in communities-based settings. These clinics are responsible for directly providing 9 required types of services, with an emphasis on the provision of 24-hour crisis care, like our suicide hotline, utilization of evidence-based practices, care coordination, and the integration of physical health care. Ultimately, this demonstration program is expected to infuse more than $1.1 billion into community-based services, making it the largest investment in mental health and addiction care in generations. But the deadline to push for more funding ends this June 2019. Senators Roy Blunt and Demi Steinbaugh are trying to expand from 8 states to 19 for another 2 years. This bill, called S-1905, would give Medicare dollars to the community clinics, and Section 223 in return for providing a wide range of mental health services. It is aimed to correct a shortcoming in the country's healthcare system, which often prioritizes care for physical ailments, but not for mental conditions such as depression, anxiety, or bipolar. More than 350 clinics serving 250,000 Medicaid patients have been able to get fully reimbursed by the federal government for the wide range of mental health care. But if funding isn't extended by June 2019, the centers may have to lay off 3,000 newly hired staff, to cut off medication assistant treatment to 9,000 patients, and reestablish waiting lists on mental health services. This would be a major loss for many teens who rely on these centers in lower income communities or more rural places. Especially when diagnoses of mentally ill are on the rise in the United States, particularly among youth. A large percent of people don't get the help they need due to a variety of reasons, including stigma around the issue, insufficient insurance coverage, and the unique nature of mental illness, which can be discouraging to patients seeking care independently. These are why the centers are so important to keep funding. Luckily, these centers, created by Section 223, was a pilot program and saw massive success. And many people expect that Congress will easily pass extended funding for these programs. This is something the government is doing very, very right. And I think if people continue this, we could be in a lot better place. However, as this may be good news for many in the US, the government has still lots to work on. Having mental health be a part of health coverage. We look at Obamacare, or the Affordable Care Act, which was one of the first ways the United States started moving for more fair and equitable coverage of mental health care. This expanded mental health coverage to many Americans through the insurance with big and small health care plans. This was not required before. Here's what the government can do. If the government wants to help. Right now, we have a mental health coverage equality in law. But when it comes to mental health versus other kinds of healthcare, we don't have the oversight that we need on health insurance companies and health plans. In the past, small health plans and large health plans have been caught using their own made-up criteria for who they could help cover to exclude people with mental illness seeking help. Mental illness is very, very, very expensive. So instead of these plants not paying for this, they decide not to fund them at all. Although the government has taken steps in addressing serious issues of mental health in teens throughout the United States, government-insured programs and data gathering programs that seek to increase awareness around the issue are helping. But the problem isn't getting any better. The current presidential administration has been slow to address it with their fight to end Affordable Care Act and their continuation of the stigma around mental health. Their lack of oversight around the fully funded community programs lets health plans dodge guidelines implemented. They continue the stigma through depiction of mentally ill individuals as violent or unstable, usually in the aftermath of a mass shooting. Finally, if you are as passionate as I am about this problem so many face, contact your state representatives. Tell them how this issue impacts you or the people around you. Funding for the community centers expired July 1st of this year. Call them. Tell them to vote for HR 3931 or SR 1905. If that is too much or it's too late, you can do other things. Tell people around you that you are loved. There are also many services to help. At Roosevelt High School, we have a suicide prevention team, people who are trained to help you. And as they might not be able to get that care you need, they can turn you into the right direction. Our teen health center at Roosevelt is also super helpful with therapists on hand. There's also other assets. The suicide hotline isn't just for extreme cases. If there's anything you want to get off your chest, or every time you feel down or you need to talk, they are there 24/7. It does not need to be an emergency. It could be if you're ever feeling any anxiety or depression. Talk to people around you. This stigma is really, really bad. People have a really hard time talking about their mental health. It's something that needs to be fixed if the government or the United States want to ever progress in having mental health in teens get any better. So thank you.